Hello, welcome to Inhaled Bronchodilators. This is the fourth section of Chapter 11, which is Emergency Medications. As always, this is Keith Woodmeyer with Wayne County EMS. Alright, here. Let's see. We're going to start off talking about the prescribed metered dose inhaler. Metered dose inhaler is used to deliver inhaled respiratory medications. A patient who has a prescribed metered dose inhaler has reversible constriction of his airway. An MDI, which is a metered dose inhaler, is small and consists of two parts, the medication canister and a plastic dispenser with a mouthpiece. Because some patients find it hard to coordinate breathing in and pressing the inhaler at the same time, a physician will often prescribe a spacer to be used with the MDI. The spacer increases the amount of medication delivered into the respiratory tract. The patient squeezes the MDI into the plastic holding chamber and then inhales the medication from the chamber. The use of spacers is very common in children and older adults. Medications contained in an MDI are usually beta-2 agonists. This means that the drug stimulates the beta-2 receptor sites in the lungs. When these receptor sites are stimulated and in the bronchioles, the smooth muscle tissues relax and ends up dilating, reducing airway resistance. This makes it easier for the patient to move air in and out. This term is known as bronchodilation. Excuse me. An EMT can assist a patient in taking a prescribed inhaler if all of the following criteria are met. Patient has signs and symptoms of respiratory emergency. Patient has physician-prescribed handheld inhaler. No contraindications to giving the medication, and specific authorization by medical direction. Some places in Kentucky actually utilize what's known as nebulized albuterol, which means that they have the ability to administer it without the patient being prescribed that medication. We'll go over that a little more in class. Assisting a patient with the use of an MDI is contraindicated in any of the following conditions. If the patient is unable to use the device, the inhaler is not prescribed to the patient, permission is not received from the medical direction, or the patient has already met the maximum prescribed dosage prior to your arrival. And that will vary system by system. Adverse effects of inhaled bronchodilators include increased heart rate, shaking or tremors, restlessness, nervousness, nausea, headache, and dizziness. An MDI automatically delivers a specific dose of medication each time it's activated. The usual dosage is 2 puffs every 3 to 4 hours as needed for shortness of breath, associated with asthma or chronic obstructive pulmonary disease, COPD. The number of inhalations is based on medical directions orders or the patient's physician's orders. And the consideration of utilizing nebulized albuterol, like some ambulances do in Kentucky, the dosage is 2.5 milligrams of albuterol and 2.5 milligrams of saline, or sterile water. Excuse me. Special considerations include using the appropriate PPE, practicing the 6 rights of medication administration, assisting the patient in finding his MDI is not readily available, assess the patient's lungs before administration of an MDI to establish baseline, assess lung sounds after administration of the MDI, and compare your findings. Wait at least 3 minutes before assisting with another dose from the MDI, and reassess vital signs and patient's degree of breathing difficulty. Alright, we're going to start out with step 1. Contact medical direction in order to assist with giving this medication. Make sure that you have the right medication, right patient, right administration, and the patient is alert enough to use this medication. Check the expiration date of the inhaler. Check to see when the last dose was taken by the patient. Make sure the inhaler is at room temperature or warmer. Shake the inhaler vigorously and several times. If the patient is wearing an oxygen mask, remove it now. Step 2, have the patient exhale deeply and then have them put his lips around the mouthpiece of the inhaler. Step 3, if the patient has a spacer device for use with the inhaler, it should be used. If a spacer is used, have the patient press the inhaler to inject the dose into the chamber of the space. This is done before placing the mouth around of the spacer. This is done before placing the mouthpiece of the spacer in the mouth. Step 4, have the patient depress the MDI as he begins to inhale deeply. Help the patient direct the spray into his mouth as he attempts to take a breath. Instruct the patient to hold his breath as long as he comfortably can. This helps with medication absorption. Step 5, if the patient is using a spacer, have him depress the inhaler, breathe in and hold his breath, breathe out, and then take another deep breath through the mouthpiece of the spacer and hold his breath. The patient who is using a spacer should try to take 2 deep breaths from the spacer and hold them for each puff from his inhaler. Step 6, replace the previously removed oxygen mask. Recheck the patient's lung sounds, vital signs, and degree of breathing difficulty. Repeat the dose after 1 to 3 minutes per instruction from medical direction. When finished with the inhaler, wipe off the mouthpiece with an alcohol swab and replace the cap. After using an MDI, have the patient rinse his mouth out with water. This will decrease the possibility of adverse effects from the medications.